Hi, guys. Welcome back for our daily practice questions. It is day 178 and our Pharm series continues. But as always, I'd like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is linked in the description and it is free. As well as my website is linked in the description with all of the resources that I offer. All right, question number one. A 50-year-old woman complains of burning pain between the third and fourth toes worsened by tight shoes. What is the first line treatment? Is it A, surgical excision of the neuroma? Is it B, steroid injection? Is it C, NSAIDs and wide toe box shoes with metatarsal pads? Or is it D, oral antibiotics? Take a moment and tell me what you got. All right, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem of the question states, what is the first line treatment? So, I always tell you when it's asking for a treatment, run it back and see if they provided you with the diagnosis. And if they have not, you got to run it back and look at the assessment findings. So, no diagnosis has been provided. So, you want to look at the assessment findings so that you can determine what it is. So, we have a 50-year-old woman complaining of burning pain between the third and fourth toes that are worsened by tight shoes. So, this is classic presentation of Morton's neuroma. So, the first line treatment we want to do is C, NSAIDs, and make sure they are wearing the appropriate size shoes. No tight shoes. A lot of times it's heels where, your feet are now in an incline, so it's pushing down. And often, if they are tighter or narrow at the toe portion, those toes are crunched. And that's why that third and fourth toe often have that burning pain. So you want to make sure they're wide box style shoes so that you can put the metatarsal pads in as well, are options for conservative management for Morton's neuroma. Question number two. A 45-year-old runner reports heel pain that is worse with the first step in the morning. What is the best initial treatment? Is it A, NSAIDs, heel stretching, and orthotic shoe inserts? Is it B, surgery? Is it C, oral corticosteroids? Or is it D, MRI of the foot? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the best initial treatment? All right, so there's no diagnosis provided, so let's see what's going on. So we have a 45-year-old runner who reports heel pain that is worse with the first step in the morning. All right, that heel pain on a runner, and especially noted early in the morning, is classic for plantar fasciitis. So your first line therapy you want to do for that is A, your NSAIDs, heel stretching, and orthotic shoe inserts. Remember to do that conservative management. And then lastly, question number three, after 6 months of conservative treatment, a patient still has disabling plantar fasciitis. What is the next step? Is it A, repeat the x-ray? Is it B, interlesional corticosteroid injection? Is it C, refer for ankle fusion? Or is it D, continue stretching only? Take a moment and tell me what you got, y'all. All right, stem of the question. What is the next step? All right, so it does have a diagnosis of plantar fasciitis, and it lets us know that after 6 months of conservative management, the patient is still having disabling symptoms, right? So if conservative management is not working, we do want to start going to the next step, which is B, with those corticosteroid injections. This can help reduce that inflammation a little bit more and more localized to give them some relief. before considering any surgical interventions, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. I tried to walk you through the musculoskeletal treatment options, but as you can see, we kind of follow a pattern, right? But as always, be sure to like, comment, subscribe, and share with whoever you may think may find it beneficial as well. And y'all know what to do. Y'all make sure y'all meet me back here. But as always, if you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. The website is also linked in the description of this video that houses everything that I offer for first time test takers as well as those who are retesting. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.